Greetings and welcome to this session from the Hypertrophic Cardiomyopathy Association. It is September 20th, 2023. It's a little after 2 o'clock Eastern Time. I'm Lisa Salberg. I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association, and I'm excited to have you join us here today for something that is quite special. This is the announcement of a brand new HCMA recognized Center of Excellence at Christ Hospital in Cincinnati, Ohio. And we are going to be meeting the co-directors in a little bit. And we're going to talk a little bit about what some of the services are that you can get at this particular institution and some interesting facts on how this institution evolved and how things got a little personal. So there's my big setup, and thank you all for starting to populate the stream. And I'm going to now introduce Dr. Mazur, who will tell us a little bit about how this program got started and introduce us to his co-director.
Lisa, it is a pleasure to be here. And I wanted to really thank you personally for the almost 2-year journey which guided us to our Clinic of Excellence. So how it started, I was always interested in hypertrophic cardiomyopathy. In my early post-medical school years, I worked in molecular lab. Next door was a molecular HCM team, which is responsible for multiple genetic discovery. I discovered the first gene, MYH, in 1989. When I became fellow, I witnessed initiation of alcohol septal ablation, was heavily involved in research. And I become very fascinated with this disease entity. Number one, from the perspective of differential diagnosis. Number two, from the perspective of treatment and how a physician, if the physician pays attention to symptoms, to physical examination, to imaging, can rapidly change the outcome and save life. I was also witnessing the first guidelines in 2002, which approved ICDs finally for patient HCM, which was a big lifesaver. And what makes me very passionate about this disease is very rapid development. We are 40 years later from the gene discovery. We're talking about gene therapy. So this is a very exciting time to be in HCM. And I feel like this is the culmination of my career.
That's so lovely. Can you introduce us to your co-director?
Yes, I would like to introduce Dr. Ankit Bhatia, who is our HCM clinic co-director and also director of advanced heart failure.
So Dr. Bhatia, you want to tell us about your role in the program?
First up, I want to thank you so much again, Lisa, too. It's an honor to be incorporated as part of the HCMA. So my journey, a little bit more brief than Dr. Mazur's, but
obviously.
But basically starting, trained as an advanced heart failure transplant cardiologist, joined Christ Hospital about 2 years ago, coming from WashU. And what I love about HCM specifically is, unlike a lot of other areas of heart failure where it's very rewarding, where you're dealing with a very sick patient population, within HCM, if it's recognized and treated appropriately with standards of care, these patients live just as long as people without HCM. And as a result, it really is very refreshing. You see people from all walks of life, all backgrounds, and you get to know not only them, but their families with it too. So it's just a very rewarding disease state. And alongside that, just as Dr. Mazur mentioned, so many rapid developments within the field, not just only in obstructive, but in the non-obstructive space and associated heart failure space as well. And I think it's all coming together to be a very unique time with major advances to come in the future.
I couldn't agree more. And I think the identification of patients who are heading to the advanced heart failure path early can really be incredibly meaningful in their outcomes. So we know that's a matter near and dear to my heart. So I'm going to go back to Dr. Mazur for a moment. Could we talk a little bit about imaging and your EP service?
Yes, absolutely.
There?
Again, my background is advanced cardiac imaging. That's what I was trained for, and that's what is my biggest passion, especially echocardiography and magnetic resonance imaging. I'm actually director of advanced cardiac imaging. So we pride ourselves of having a state-of-the-art echo lab. But also thanks to you, Lisa, we improve our standards. We have a group of technologists who are trained in acquiring images of HCM patients, trained in performing correct Valsalva maneuvers. Those are technologists who perform regular echo with myosin inhibitors. And we have a phenomenal cardiac MRI program, which is really my pride. We publish multiple studies related to cardiac MRI imaging. And as such, we provide a really complete service to our patients. In addition, we have dedicated electrophysiologists who are helping us out managing our patient. We have a team which consists of a device implanter who sees our patients, and upon our referral and after the patient is evaluated, we discuss especially the 2B indications. Should we move with device, should not be moved device. We discuss, of course, the indication for the biventricular pacing with left bundle less than 50% ejection fraction. And also we have a team of electrophysiologists who have particular interest in atrial fibrillation ablation in patients with hypertrophic cardiomyopathy. And as we know, the atrial fibrillation in HCM is very common, worsens patient prognosis, increases risk of stroke, and deteriorates quality of life.
Okay, so we provide imaging, electrophysiology, advanced heart failure. You do have a surgical program as well.
Correct.
About that?
Yes, we have a very experienced surgeon who performed over 400 of those procedures. And we all know that the outcomes are related to volume of the center. So far, we have excellent outcomes with essentially no complication. Since we started our HCM clinic, in past 12 months, we performed over 30 myomectomies without any complications. We have regular meetings with the surgeons to discuss the case prior to surgery, review advanced imaging. And when the cases are complex, we even provide the surgeon a 3D print of the heart prior to procedure.
So everybody can kind of see where we leaned into wanting to know more about this center and help them develop. They also service an area of the country that didn't have any other center of excellence within a 2 to 3 hour drive. So we're increasing access to care in the communities where people live, which is critically important. So I want to take a moment and pivot to research. You're doing a few trials coming up, and plug for our webinar this evening with Melinda Tsai from the Cleveland Clinic and Martin Marin from Leahy Clinic. We're going to be talking about myosin inhibitor trials. And I understand you guys might be a site where people can get access to some of these trials. Tell us what you're doing.
Yeah, so it's a really exciting time from a research standpoint. So as we all know, the myosin inhibitors have shown great promise and now are approved on the obstructive side. And then the next real frontier of that is evaluating them on the non-obstructive side, specifically their role in heart failure and improving heart failure symptoms and diastolic dysfunction. So we have been accepted as a site for both the mavacamten and aficamten phase 3 non-obstructive HCM trials, and those will be launching here in the next 1 to 2 months. And we're very excited. We have patients already excited to line up for those, but really would encourage anybody interested to join the webinar tonight and learn more. We have seen anecdotally in our obstructive patients already significant improvements in their heart relaxation and heart failure symptoms. So we hope to extrapolate that and see what the results of this trial will be. In addition, and very excitingly, we also will be involved in the upcoming first-in-human gene therapy trial for hypertrophic cardiomyopathy. So looking forward to that. That looks to be headed towards enrollment here at the end of the year.
So that's the TENAYA study for myosin binding protein C mutations. If anybody is interested in learning more about that particular trial, they're welcome to call the office and we can connect you with the site coordinator or the representative from the company's recruiting arm. So that's fantastic. So I'm going to take a little twist here, and one that I don't normally take in welcoming a new center on board. So, Dr. Mazur, this got a little personal for you shortly after our site visit. So, could you tell us what made this a little bit more personal?
Yes, absolutely. So I started developing symptoms which I contribute to aging. I am overall athletic person, enjoy biking, enjoy exercising, started slowing down. Even my slightly overweight brother, who is 7 years older, noted it on our vacation. And finally, I got a phone call from my primary care physician. It's time for a visit. You have not seen me for 5 years. And my primary care doctor listens to me and tell me you have a murmur. My answer immediately was, I don't have one. I'm a cardiologist. I know better. So long story short, around the time when you notified us that we met all our requirements to become Center of Excellence, I myself was diagnosed with hypertrophic cardiomyopathy. And suddenly also my family history kind of changed. My mother died suddenly at the age of 44, and we just contributed in the past to myocardial infarction. And what surprised me about the symptoms is the variability of the symptoms. One day is lousy, one day is great. So when I see patients, I can compare their experiences to my experiences, and I can physically connect with them, which gives me additional advantage.
It's a very hard concept to explain to a physician that today I'm perfectly fine, but yesterday I couldn't get up my front stairs without struggling. And sometimes even we, the patients, feel like we're a little crazy and think that this may more be mind over matter, but it's heart over matter. And to have a clinician who can understand this frustrating and complex aspect of HCM's variability, I think gives you a very unique insight. And I'm sure over time we'll learn how to use that experience to hopefully train your colleagues and let them understand things from a different point of view. So I don't like new members of the community because it's, you never want somebody to have a diagnosis that's rough. But it's a good time to have a bad disease. And HCM has a lot of treatments and a lot of promise for the future and a lot of good clinical care available to us now. So I thank you for sharing your personal journey. It's not always easy.
And I just wanted to let you know who is my personal cardiologist, Dr. Bhatia.
Yeah, so that's something in itself right there.
Yes.
So I'm sure over the future, we'll talk a little bit more about your personal experience. I don't know if you've ever listened to our Tales from the Heart with Dr. Alex DeFaria from UPenn, but he's
Yes.
another clinician with a diagnosis he's had a myectomy. So I think there's going to be more power in the community because you take that knowledge of cardiology and that patient experience and you merge them in a unique way. So I'm kind of excited about what might come next with that. So tonight we have right now about 250 people signed up for our myosin inhibitor webinar. If you're listening now and you're not signed up, please sign up and do so. If you're watching this in post-production when we're not live, you can go to our YouTube channel and watch any programming that we've created from the YouTube channel. So we hope you'll join us there. So getting back to the Center of Excellence and what else you guys are up to over there. So you also have a friendly relationship with Children's Hospital across town. And we're going to be doing an individual site visit because they are an individual institution. So can one of you address the pediatric arm of this program?
Yes. We have a very close relationship with Cincinnati Children's Hospital Medical Center, which, as most of you probably know, is #1 pediatric hospital in the country. I personally have been working in multiple research projects with them for over 15 years, published multiple papers initially on Duchenne muscular dystrophy and cardiomyopathy associated with this disease. We are partnering with them to help transitioning of adult patient to adult world. And of course, they've been waiting for us to become center of excellence because this is a measure of quality. In addition, we work very closely with their digital team to develop visual guidance for the patients. For example, I'll grab the heart right now. This is a heart which was printed based on a CT scan from a patient who went for surgery. And this is a very helpful tool to explain to the patient what's going on. I typically ask the patient to stick the finger into an LVOT, and they understand why something has to be done. We are working also on interactive screens where the patient can look at their heart depending and models depending on the type of HCM, and also on virtual reality experience. Patient will be able to put virtual reality goggles and walk through the heart.
I saw that when I was out at the site visit. My vertigo and my vision issues keep me from putting the goggles on, but I got to see it on the big screen, and it was an amazing experience to kind of be standing next to your mitral valve and like be right there and understand the apparatus. I'm an anatomy geek. I love to figure out why everything works like it does. And for people who want a more visual, tactile feel, while we're not to the point where we can do this in every clinic visit on their individual hearts, but we're getting there. And we might be able to integrate some of these processes and maybe help these young ones understand their hearts a little bit better and demystify what's going on internally with technology. So we're really excited about the forward thinking of the hospital and the system. And I do have to kind of lean into the rest of this equation. You are two very talented clinicians with interest in the disease, but without the institution supporting you to build and provide you with the resources to build a strong program, we don't go anywhere. So I just want to acknowledge the entire hospital administration, your chief of cardiology, and the rest of the HCM team that's not here with us today, that we know it takes a village and we know it takes resources, and we appreciate the investment in our community. And I have to give a big shout out to the woman sitting to your side, to Cassidy. We're trying. Sonographer that stands, shoulder to shoulder with almost any clinician I've ever had an opportunity to speak with about HCM. You have a real resource and a very intelligent woman on your team, and I'm really proud of what she's accomplished and how she's helped you guys get organized. So letting the institution know Cassidy is very important.
We could not have accomplished this without her help.
And I want to put a plug in that we are one of the sites that's been chosen for the AHA upcoming best practices webinar series. That in the first one that's going to be coming up later this month, we can get the exact date, will actually feature Cassidy and her role in helping to build the HCM program.
That is fantastic. It certainly takes a village to treat the village. So we want to acknowledge and we want to thank. We've already got 2 new registrants for the webinar tonight as we're talking. So keep that coming, guys. Okay, so what other things should we know about the Cincinnati area for those who might be traveling a little bit further to get there? Is there anything? I know one thing I like about Cincinnati.
Yes.
It's the zoo.
It's the zoo.
And Fiona. I'm a Fiona fan. And if you don't know who Fiona the hippopotamus is, you need to go look her up. So other than the zoo, what else do people need to know about Cincinnati?
So first, let me comment about zoo, because I'm also a zoo cardiologist. I participate personally for past 15 years in a Great Ape project, where our team performs echocardiography on either awake apes or apes under anesthesia, and I provide interpretation. And since I'm a transplanted Cincinnatian, I will ask Cassidy to tell a little bit about the city of Cincinnati.
Cincinnati is a very diverse city. The weather changes depending on the season. Okay, I guess I'll scoot in. We offer amusement parks. We have really good free parks. Yeah, I think that's it.
Good restaurants, good food. I would say there are also good breweries, but I advise any HCM patients against alcohol consumption. Period.
Well, a beer here and there with some water before and after.
Yes.
So we want to keep everybody healthy and happy. I flew into Cincinnati for the site visit. It was an easy fly-in. It was easy commuting around town. It's a well laid out city. There's hotels that are convenient to the hospital, and we'll be listing that in your directory listing as well. So if you're flying in or driving from a distance, there were, it was a safe, comfortable community, and I felt like it could support quite the traffic to come in from out of town and handle whatever cardiac needs somebody might have within the region. So we are really excited to have you on board. We're looking forward to bringing the PEDS program up soon, but we do have collaboration with the PEDS so that if a family needs to be screened, we can take care of the littles and the bigs relatively easily. I thank you all for your participation in our ever growing endeavor of bringing HCM care closer to people's homes. I know some people want us to move a little faster on this, but it takes a lot to get organized. And it takes the ability of a medical system to look within and figure out where they are, build a strong foundation to build a program that's going to last the generations. And that is our hope, that we keep these programs running and growing and that they become part of your family like they're part of the HCMA family. So guys, girls, thank you for everything. And to Stacy Titus, our Center of Excellence coordinator, thank you for bringing this one all the way through. I think this was Stacy's first start to finish program since she started with us about 2 years ago. So congratulations to Stacy for that milestone. And we look forward to working with you all. And if you're interested in clinical trials, please remember that Christ Hospital is there for you as a clinical trial site.
Thank you. But I also would like to recognize you because without your guidance, we would not be where we are. The problem with medical field is sometimes you feel that you're doing a very good job until somebody from outside performs the assessment. And I really appreciate your guidance, the way you directed us toward development of this HCM clinic. And we are very proud right now to tell you that our guidelines compliance is 100%.
Let's talk about that for just a minute.
Okay.
So
nothing uncomfortable?
No, because no, I think this is just a really good way for people to understand how centers become centers. One of the very first conversations we have with a center is their proposed director and I will just have a conversation. What do you think you're doing in HCM right now? How do you think you're doing in compared to the guidelines? Do all the patients in your hospital system have adequate follow-up? Have they had the right imaging? Have they had the right testing? Have they been offered genetics? Has the family been screened? How do you think you're doing? And they all tell me they're doing great. And I go, you probably have some work to do. And I send them back to look at their data and to assess patient care and look at the whole system, not just the patients that they know. And that's where we find problems. And that's where we also develop solutions. Finding problems doesn't mean you point at it and say, you're bad. It means here's an opportunity for correction. And it's a hard thing to do for a medical center to look and say, oh, how do we fix these problems? We give a pretty clear map to how it can be done. And it's whether the center does it or not that matters. And I will never forget our first call and the look on your face when I told you what I thought the numbers would be in compliance. And you're like, no, you don't know what you're talking about. I'm like, honey, I've done this a few times. Let's look at the data. And you came back with honesty and a bit of awareness and a little surprise that, oh, yeah, we got some work to do. But then you did the work and you cleaned up the system and you made patients safer and you made their quality of life improve. and we found more family members who needed help. And there's the magic. Now we just keep it rolling. So I thank you for doing the hard work. And I know it's not always easy, but it's really important. So thank you.
And
we
Lisa,
learn also to be humble and to be open to growth. And I think what is so important about our center is we are open to growth and open to criticism.
And we have seen that really not only with compliance to guidelines, which have dramatically increased, but with a ripple effect in terms of education of every single subspecialty. We're seeing it with proactive nature that patients are being screened for any sort of defibrillator. We're seeing it for proactive assessment of advanced heart failure. Your presence and the presence of this program being recognized as a Center of Excellence has made everyone better.
Thank you. I really appreciate that. And I think sometimes a logo or a designation, people don't understand what came behind it. And that it's not a moment in time. Yes, we're celebrating that we got to this milestone, and we're going to continue to do the hard work. And we're going to keep communicating, and we're going to keep making it better. And we're going to find things that we didn't think we were going to find. And then we're going to fix, improve, learn, teach, expand. Clinical trials are just one of those areas, but clinical excellence comes in the repetition of seeing these patients through a system. We hone the system, we make it more effective, we make it a more enjoyable experience for the patient. We treat more than just the heart, we treat the whole person. And that comes with time, evolution, and the ability to understand where there are gaps in care and things need to be filled. So you have a very unique perspective in-house there now. We will get into a conversation at some later date on a podcast about choosing therapeutic options when you're a cardiologist with hypertrophic cardiomyopathy. We'll leave that one as a teaser for a follow-up visit. But I thank you all for all the hard work that you did to get to here. And I'm glad that we got Cassidy to come on camera with us because she was an integral part of making this all happen. So guys, thank you so much. And I don't think we have any questions from the community that I can currently see. Let me just double check. If anybody has a question, they would post it now. And there's private chat. Okay, I don't know what that's all about. Something about a 98 Degrees concert. That must have been from Stacy. Oh, the Cincinnati thing. Now I understand it. Okay, no questions right now, so that's good. If anybody has any follow-up questions for us, we're just getting used to using StreamYard. So if you're trying to talk to us from LinkedIn or Twitter, I'm not so sure that I can see your comments right now. So we'll follow back up with you later. Any final comments before I let you go back to work and treat those HCM patients?
Yes, you mentioned taking care of entire person. And
yes,
we pride ourselves to do that. We screen patients for obstructive sleep apnea. We get the appointment with sleep specialists within a couple of days rather than normal waiting of 3 months. We screen patients for depression. We have a dedicated psychiatrist who sees patients with HCM. We communicate with primary care physician regarding treatment of hypertension and diabetes. We help the patient to find ways to lose weight. We know that, unfortunately, when you cannot exercise, you gain weight and you enter a vicious cycle. So we see the entire human being, not just dynamic obstruction.
Excellent point. Thank you for wrapping with that. Okay, ladies and gentlemen, Christ Hospital, Center 50, 50, big number, milestone number, for the Hypertrophic Cardiomyopathy Association's Center of Excellence program. We are really proud to have you on our team, and we look forward to great things ahead. Thank you all for joining us today. Have a great day, and don't forget to join us tonight for the webinar on myosin inhibitors.
Thank you.
Thank you.